Hey there, curious minds. Ever wondered what makes hearing possible? Or how you maintain your balance? The answer lies within this fascinating bone right here, the temporal bone. Today, we're diving deep into the mysteries of this essential part of our anatomy. Stay tuned, because what you're about to learn might just blow your mind. The temporal bone provides that critical protection and support, ensuring our hearing and balance systems function seamlessly. Think about the last time you enjoyed your favorite song or felt the thrill of dancing. All those experiences are thanks to the structures housed within the temporal bone. The temporal bone isn't just a random piece of our skull. It's a powerhouse of functionalities. Let's break it down. Quick facts. Location: neurocranium. Bone type: irregular bone. Articulates with parietal, occipital, sphenoid, and zygomatic bones. Arterial supply: middle meningeal, posterior auricular, and stylomastoid arteries. Key features and anatomical relations. The temporal bones are a pair of large bones found along the infralateral aspects of the cranium. They are classified as irregular bones, contain the middle ear and internal ear, and contribute to the formation of the neurocranium. Ossification. Ossification of each temporal bone occurs at many ossification centers. These are found in the squamous part, with one center found in it, which appears in utero during the second month. Tympanic part, with 1 to 4 centers found in it, which appear in utero during the third month. Petrous and mastoid parts, with many centers found in these, which appear in utero after the 5th month. Styloid process, with 2 centers found in it, which appear around the time of birth. The ossification centers for the tympanic and squamous parts fuse with each other before birth. The petrous and mastoid parts and the styloid process fuse with the rest of the temporal bone during the first year after birth. Variations. In some individuals, the styloid process may be present in a more elongated form. The frontal and temporal bones do not meet each other and articulate, resulting in the parietal and sphenoid bones meeting and articulating. The temporal bone also displays sexual dimorphism, where the mastoid processes and temporal lines tend to be less prominent and more gracile in females than in males standarding. Surface anatomy. The following bony features of each temporal bone are relevant to surface anatomy. The mastoid process is palpable posterior to the external ear. The zygomatic arch, which is formed by both the zygomatic process of temporal bone and the temporal process of zygomatic bone, is palpable. List of clinical correlates. Fracture of temporal bone. Osteitis deformans Paget disease of bone. Osteomyelitis of temporal bone. Mastoiditis of temporal bone. Craniosynostosis. Zygomatic arch dysplasia. Parts of temporal bone. 1. The mastoid part is the posterolaterally located, thick portion of the temporal bone. It is continuous anteromedially with the petrous part, anteriorly with both the squamous and tympanic parts. The mastoid part consists of 2 surfaces, internal and external, 2 borders, parietal and occipital, mastoid and stylomastoid foramina. The mastoid part articulates superiorly with the mastoid angle of the parietal bone, forming the parietomastoid suture. Posteriorly, with the mastoid border of the occipital bone, forming the occipitomastoid suture. 2. The petrous part is the medially located dense pyramidal portion of the temporal bone. It is continuous laterally with the squamous, mastoid, and tympanic parts of the temporal bone. The petrous part consists of a base, which is fused with the squamous, mastoid, and tympanic parts, an apex, 3 surfaces anterior, posterior, and inferior, 3 borders anterior, posterior, and superior, the carotid canal, and internal acoustic meatus, the petrous part articulates, anteriorly with the greater wing of sphenoid bone, forming the sphenopetrosal synchondrosis, medially with both the basilar and lateral parts of the occipital bone, forming the petrooccipital synchondrosis. 3. The squamous part is the anterolaterally located thin, curved portion of the temporal bone. It is continuous, medially with the petrous part, inferiorly with the tympanic part, posteriorly with the mastoid part. The squamous part consists of 2 surfaces cerebral and temporal, 2 borders sphenoidal and parietal, a zygomatic process. The squamous part articulates anteriorly with the squamosal margin of the greater wing of sphenoid bone, forming the sphenosquamous suture, posteriorly with the squamosal border of the parietal bone, forming the squamous suture. 4. The styloid process is the long, pointed, inferior projection found along the inferior aspect of the temporal bone. It is located anterior to the stylomastoid foramen, anteromedial to the mastoid process, medial to the mandibular fossa, lateral to the jugular fossa. Its superior end is surrounded by the sheath of the styloid process, which extends inferiorly from the tympanic part of temporal bone. The styloid process of temporal bone provides origin sites for the stylopharyngeus, styloglossus, and stylohyoid muscles, as well as attachment sites for the stylomandibular and stylohyoid ligaments. 5. The tympanic part tympanic plate is the inferiorly located, curved plate of the temporal bone. It is continuous. The tympanic part provides attachment sites for the tympanic membrane and the cartilaginous part of the external acoustic meatus. It also accommodates a portion of the parotid gland. 6. The external acoustic meatus, external auditory meatus, or external auditory canal, is a tubular passage found in each temporal bone. It allows for the passage of sound waves from the external ear to the tympanic membrane. 7. The carotid canal is an anteromedially located, tubular passage found in the petrous part of each temporal bone. It extends anteromedially from its extracranial opening along the inferior surface of the petrous part to its intracranial opening at the apex of the petrous part. The carotid canal allows for the passage of the internal carotid artery into the middle cranial fossa of the cranial cavity from the neck, along with its accompanying internal carotid venous and nerve plexuses. 8. The foramen lacerum is a relatively large, irregularly shaped opening found along the posteromedial area of the middle cranial fossa. The foramen lacerum allows for the passage of meningeal arterial branches, emissary veins, and a deep petrosal nerve. 9. The hiatus for greater petrosal nerve facial hiatus is a small, medially located opening found along the anterior surface of the petrous part of each temporal bone. Has a groove for greater petrosal nerve extending anteromedially from it. Allows for the passage of a greater petrosal nerve. 10. The hiatus for lesser petrosal nerve is a small, laterally located opening found along the anterior surface of the petrous part of each temporal bone. Has a groove for lesser petrosal nerve extending anteromedially from it. Allows for the passage of a lesser petrosal nerve. 11. The internal acoustic meatus, internal auditory meatus, or internal auditory canal, is a tubular passage found in the petrous part of each temporal bone. The internal acoustic meatus allows for the passage of the labyrinthine artery and veins, as well as the vestibulocollar, facial, and intermediate nerves. 12. The jugular foramen is a large, irregularly shaped opening found along the posterolateral area of the cranial base, lateral to the foramen magnum. The jugular foramen allows for the passage of the meningeal branch of the occipital artery, internal jugular vein, and inferior petrosal sinus, as well as the glossopharyngeal, vagus, and spinal accessory nerves. 13. The mastoid foramen is the small, round, posterior-inferiorly located opening found posterior to the mastoid process on the mastoid part of each temporal bone. It allows for the passage of the mastoid branch of the occipital artery and the mastoid emissary vein. 14. The stylomastoid foramen is a small, round, antero-inferiorly located opening found along the mastoid part of each temporal bone, and allows for the passage of the facial nerve and the stylomastoid artery and vein. Sutures. 1. The occipitomastoid suture is a fibrous joint found along the lateral aspect of the cranium. It is the articulation site located between the mastoid border of the occipital bone and the occipital border of the mastoid part of temporal bone. 2. The parietomastoid suture is a fibrous joint found along the lateral aspect of the cranium. It is the articulation site located between the mastoid angle of the parietal bone and the mastoid part of the temporal bone. The parietomastoid suture is continuous anteriorly with the squamous suture. 3. The petrooccipital synchondrosis is a cartilaginous joint found along the inferior aspect of the cranium. It is the articulation site located between the petrous part of temporal bone and both the basilar and lateral parts of the occipital bone. 4. The sphenopetrosal synchondrosis is a cartilaginous joint found along the inferior aspect of the cranium. It is the articulation site located between the greater wing of sphenoid bone and the petrous part of temporal bone. 5. The sphenosquamous suture, sphenoesquamosal suture, is a fibrous joint found along the lateral aspect of the cranium. It is the articulation site located between the squamosal margin of the greater wing of sphenoid bone and the sphenoidal border of the squamous part of temporal bone. 6. The squamous suture, squamosal, squamoparietal, or parietosquamosal suture, is a fibrous joint found along the lateral aspect of the cranium. It is the articulation site located between the squamosal border of the parietal bone and the parietal border of the squamous part of temporal bone. The squamous suture is continuous posteriorly with the parietomastoid suture. 7. The temporozygomatic suture, zygomatic temporal suture, is a fibrous joint found along the lateral aspect of the cranium. It is the articulation site located between the zygomatic process of the temporal bone and the temporal process of the zygomatic bone. Craniometrics. 1. The asterion is a craniometric point found along the lateral aspect of the cranium. It is formed by the occipital, parietal, and temporal bones. 2. The mastoidal is a craniometric point found along the lateral aspect of the cranium. It is located at the most inferior tip of the mastoid process of temporal bone. 3. The porion is a craniometric point found along the lateral aspect of the cranium. It is located on the temporal bone and is the most superior portion of the margin that forms the external acoustic meatus. 4. The pterion is a craniometric point found along the lateral aspect of the cranium. It is formed by the frontal, parietal, sphenoid, and temporal bones and is located at the area of the temporal fossa where these four bones meet. The pterion is the location site for the sphenoidal anterolateral fontanelle in infants. But there's more. The temporal bone also plays a role in our facial expressions and jaw movements, connecting to the mandible and supporting muscles involved in chewing and speaking. It's a multitasker, and we often take it for granted. If you found this deep dive into the temporal bone as fascinating as I did, hit that like button and share this video with your friends. And don't forget to subscribe for more intriguing insights into the wonders of the human body. Leave a comment below if you have any questions or topics you'd like us to explore next. Thanks for watching, and until next time, keep exploring the marvels of anatomy.